Dear colleagues, dear participants, ladies and gentlemen, first of all, I would like to thank CEOP Europe for the invitation for hosting this special and informative event every year. Further, I would like to thank the honorable speakers for giving up some of their time in order of work making this event happening. I'm really honored to be the host. This is a personal matter for me, and most of you know my story. As a member of the parliament, as a full member of BEGA committee, and as the chair of MEPs Against Cancer Intergroup, I am committed to this fight. Cancer remains the first cause of death by disease in Europe in children over the age of 1. Over 6,000 young patients die every year. I do believe that we all have the same right to health. It should not matter where you are born or where you live. However, we all know there are still important inequalities for access to the best available childhood cancer care across the European Union. After months of talks, the mandate of the Special Committee on Cancer in the European Parliament has come to an end. We have now a concrete report which it will be voted at the next plenary session and that needs to be taken into account by the Commission. The EU data protection law has indeed protected health data. However, it should not be an obstacle in preventing the life of all the patients in Europe. In addition, we have to address the inequalities in access in the best available childhood cancer care across Europe. It's unacceptable to have different survival rates between different European countries. The expenses of the families which go abroad with their children for treatments should be covered. A holistic EU effort dedicated to childhood cancer is needed to boost life-saving gains. If we all work together with the Commissioner of Health, Stella Kyriakidis, with all the organizations that are very devoted to the fight against childhood cancer, like CEOP, with parents, with scientists, we will make an impact. Until the day that the fight against childhood cancer is gone, we have to ensure the best possible care for all the children. Thank you so much for your dedication and hard work. We are one and we are going to win this fight for us and mostly for our children. Thank you very much.
Thank you. Thank you very much, Mr. Fourlas. It's a real pleasure to have you as a host of this important meeting. And let me thank all the participants to this important event. I am Carmelo Rizzeri. I am the president of the European Society of Pediatric Oncology. And I have seen that the program today is very, very interesting. And the topic will be the GDPR, so the General Data Protection. And the speakers will allow us to better understand what does it mean for children with cancer. Let me also give you some technical information. You may see here on the slide shown on your screens some technical information, and I will hand over now the floor to Ms. Anita Kinesberger, who is the chair of the CCI Europe. Please, Anita.
Thank you, Carmelo. Yeah, and on behalf of patients, parents, and survivors, CCI Europe wants to welcome all of you for this important event regarding GDPR, and it's our first one on this topic, and its better implementation on the national and institutional level. It is very important for us to highlight and discuss all the challenges we face when it comes to research. Therefore, we are more than interested to find ways how we can tackle the existing problems, and I'm really looking forward to all the speeches and inputs in the next 2 hours. Thanks for inviting us, and yeah, handing over to Carmelo again.
Thank you. Thank you very much. So we can start with the program. The first part of the program is dedicated to some messages coming from, let's say, MEPs, commissioners, and the friends of the pediatric oncology. I would like to start with Stella Kyriakides, who is the European Commissioner for Health and Food Safety, who will deliver a special video address on the occasion of this International Childhood Cancer Awareness Day this year. So I think that we can go with the video message.
Distinguished guests, ladies and gentlemen, I am pleased to be joining you to mark International Childhood Cancer Awareness Day. It is a day on which we are raising awareness on global efforts against childhood cancers, recognizing their major impact on the children, their families, and their friends. Those efforts must continue. I say this because despite the vast recent improvements in cancer survival for children in Europe, we lost around 2,000 of our children to this disease in 2020. It is the #1 cause of death by disease in children over 1. Additionally, the COVID-19 pandemic has led to postponed checkups, screenings, and treatments. And that is why Europe's Beating Cancer Plan, we are putting childhood cancer at the center, with ambitious policy actions and research efforts, from prevention via treatment to survivorship. To promote a healthy and active lifestyle among our young people and reduce cancer risks, we are working on initiatives like creating a tobacco-free generation and revising the EU school fruit, vegetables and milk scheme. The flagship Helping Children with Cancer initiative will give children access to rapid and optimal detection, early diagnosis, treatment and care. The Interspeciality Cancer Training Program will support the pediatric cancer community. And the European Cancer Information System now has a new section on pediatric cancers. And to offer young patients and survivors a better quality of life, we will address the needs of children whose lives have been touched by cancer and help bringing their families and carers together through the launch of our EU network of youth cancer survivors. To see all these actions through, we have a clear roadmap with milestones and a timeline. We have a strong joint governance, including stakeholders like the European Society for Pediatric Oncology. And we have impressive financial funding of €4 billion. This year's Awareness Day focuses on the General Data Protection Regulation in the context of European initiatives on childhood cancer. Cross-border sharing of health data is important to pediatric cancer. With that in mind, the Commission is working on a legislative proposal for a European health data space. What this space will do is facilitate access to and sharing of health data for healthcare, research, innovation, regulatory, policymaking, and statistical purposes. What it will not do is compromise the rights and safeguards that our data protection rules provide. Ladies and gentlemen, it's clear to us that to benefit children and adolescents with cancer, all EU policies and the whole community, professionals, parents, children need to be involved. And that is how Europe's Beating Cancer Plan can become a real game changer for young people all over Europe. Together, we can stop cancer from taking the childhood our children deserve away from them. I know that I can count on the MEPs Against Cancer Interest Group, the European Society for Pediatric Oncology, and all European childhood cancer organizations for support in this worthwhile endeavor. I wish your event every success. I thank my friend MEP Loucas Fourlas for the invitation. Thank you.
Well, thank you. Thank you. That it was very nice to hear Commissioner Stella Kyriakides summarizing so beautifully and so comprehensively the various topics will be faced this morning in this event. So I think that the audience will take advantage from this initial synthesis. I will hand now the floor virtually through a video clip to Mr. Manfred Weber, member of the European Parliament and the EPP Group Chairman, who is one of our, let's say, old friends of pediatric oncology. Please.
Dear Lucas, dear ladies and gentlemen, thank you so much for giving me the opportunity to say a few words at the beginning of your conference. We talk about fighting against cancer, and especially when we take care about our children who are affected by cancer. You know, the EPP Group, the biggest political family in the European Union, was a driving force to put cancer as a top issue on the European agenda. We promised during the last European elections that if you vote for us, then we will deliver on this. And now Commission, the European Commission, together with Council, also with the French presidency, now we are upgrading cancer as a real top issue for Europe. We are delivering on this promise. For us as EPP Group, there are three top issues currently obviously on the table. One is data. We have to collect data. We have to use the data European-wide in a much better way to fight against cancer. The second thing is that we have to combine our research activities. A lot is going on research, and it's obvious if we do it together, then we are stronger. If we combine all money we spend on research and we do it together, we organize and coordinate in a better way, then we are more successful. And finally, one key question is for us that there are no second and first class Europeans. The treatment for cancer patients, especially for children again, must be in the east, in the south, in the north, and in the west of Europe the same. We cannot again allow to have first and second class Europeans. Few considerations which are in our mind when we speak about the fight against cancer. Now it's up to you in your conference with all the experts and friends sitting together, talking and discussing about efforts on European level, further activities on European level to strengthen our fight in beating cancer. We started the process. Now it's in our hands, also in your hands, to make out of this process a success story. And I believe in the idea to beat cancer. Thank you so much.
Thank you very much to Manfred Weber. I'm always very happy when I listen people saying our children. The children with cancer are not the children only of their parents, are the children and the sons of all the community of pediatric oncology. I'm particularly glad to Manfred Weber for his nice and kind words. It's now in our hands to go on. Now I will give the floor, or we will listen to a video message from the non-profit childhood cancer organization in Cyprus, Little Heroes, which organizes many activities and will be displayed in this brief video clip. Please.
It's an honor to be with you today. On behalf of the whole team of the Little Heroes, I would like to express my congratulations for the organization of this event to CEOP. I'm here to represent and introduce the Little Heroes. The Little Heroes is a charity organization which started its activity as an initiative inspired by the member of the Parliament, Loucas Fourlas, in 2017. It aims to assist the financial and psychological support of children and their families who are battling cancer and leukemia in the Pediatric Oncology department. The Little Heroes are fighters. They deserve to live with dignity and experience childhood. People who help the whole effort, they are friends, known and unknown. It is an effort these friends have embraced, and every year the team grows. Foundation is run by volunteers with no overhead cost, covering the expenses of the families which go abroad for treatments.
Little Heroes supported dozens of families.
We do this through various events and contributions made by the Foundation. Our activities include a large annual event which takes place every December. Loucas Fourlas swims with friends, scientists, state officials, sending the message that no child should fight alone.
The founder of Pediatric Oncology Hematology in Cyprus, Dr. Loizos Loizou, was among them. At the same time, we also host the March Path Love. Besides that, we have an event called Golden September, which is a month of awareness on childhood cancer. The Presidential Palace in Cyprus and Limassol City Hall are lit up in the colors of gold. During Golden September, many members of the student movement Maki disguised themselves as fairy tale heroes and paraded around the hospital, giving a magical show to the little heroes. In 2021, our foundation met with children who traveled from Israel to Cyprus through a treatment program for little heroes battling cancer. In addition, in order to honor little heroes and raise awareness for childhood cancer, popular football teams in Cyprus wore the t-shirt with our logo. This is a collective battle and a personal matter for all of us. We join forces because no child and their family should fight alone. Thank you, Siope.
Thank you very much. I have to say that I am moved by this video clip that fortunately we can, in each one of our countries, we can see such a warmth around us and around our kids. So a really great message of hope from this charity. I think that we have finished the first part, and we will go now to the real first part, which is the presentation of the state of play, with the presentation of an essay of a survey which has been conducted among the people and the people of the pediatric oncology community. This survey was conducted looking for the highlighting the implications for childhood cancer research in Europe. It is on this day that we will present through two distinguished speakers, Professor Gilles Vassal and Mrs. Delphine Hennen, who will talk us about the results of this and will tell us of the views of the parents regarding the GDPR. So I will give the floor to Professor Vassal, who is a board member and policy lead of the European Society of Pediatric Oncology and working in Paris, France. Gilles, the floor is yours.
Thank you, Carmelo. Indeed, we would like to share with you some information we gathered from our community in order to nourish the discussion with the panel on how to improve GDPR in the field of childhood cancer research. Next slide. Why this topic? We really need to accelerate innovation and improve treatment to cure more children, to cure them better, and to tackle inequalities. This is the objective of the European Union. We remember that every childhood cancer is rare or ultra rare. And sharing and reusing data and biological sample is absolutely paramount to make the progress that are needed and expected by everyone to really achieve the goal. As an example on the next slide, I wanted to share with you an initiative that was started in 2004. 5 international cooperative groups decided to work together and share data on neuroblastoma, a childhood cancer in young children representing 7% of all cancer. And they created INRG, International Neuroblastoma Risk Group Task Force, a truly international initiative. And in 2022, clinical and molecular information from more than 20,000 children with neuroblastoma are now aggregated and available for research and improvement of care and diagnosis. It illustrates that working together is a common theme in our community, and clearly we are able to aggregate all the data that we are generating. And clearly we wanted to address the GDPR issue today because we have among you in Europe several concerns about the fact that GDPR would slow down the implementation of this research. So we conducted the survey to figure out exactly what it was in our community on the next slide. The survey was conducted in December. We had 128 respondents from 28 European countries. 82% of the respondents are aware of the GDPR. 91% respondents consider there is value in the regulation protecting the privacy of EU citizens. It is not a fight against GDPR. It is an excellent regulation to protect the privacy of EU citizens. Next slide. 92% of them are doing activities of sharing health data and research data, 92%, illustrating that in pediatric oncology, research and care are really integrated to really make progress for every child. And the comment was very clear. Childhood cancer research became more difficult with GDPR. I will not go into detail, but it was a clear message. And from this, we identify a few, not few, but 6 recommendations that could improve the implementation of GDPR to facilitate data sharing and exploring and research for childhood cancer. And I would briefly comment these 6 recommendations. The first one is harmonized implementation and interpretation across Europe. We understood that despite it is a regulation, the implementation is different from a country to another country, and even from an institution to another institution, which really generated this heterogeneity, this discrepancy, major complexity in implementing the cross-Europe program that we are developing. So clearly harmonizing the implementation and interpretation would really help facilitate the research for children with cancer. Next slide. We propose to have a one-time broad consent from patients and parents and legal guardians to facilitate the reuse of secondary data, the secondary use of data and tissues in our research. Interestingly, in some countries it is feasible, in other countries it is not feasible. Again, heterogeneity, discrepancy, slowing down the implementation of such research. And one topic about the reconsenting at the age of 18 is something that we could discuss as well. The third recommendation is population-based cancer registration, which is absolutely essential. And it was mentioned by Stelia Kedakides about the ECIS, the new cancer information system, really to generate the metrics to monitor what's happening in Europe, should be done without obligation of explicit patient consent. And it appears in some countries, but not in other one country. Harmonization. And the fourth one is facilitating secure data exchange outside the EU for public health and academic research purposes. I gave you an example of INRG. This is a beautiful example of how we can set up strong assets at the international level that would serve each child on the globe. And finally, the last 2 recommendations, which are very much technical, on the next slide, I will not detail, is considering pseudonymized data, the one that are key coded, could be anonymized in certain circumstances, and also the support of privacy keeping data linkage by all the by the state-of-the-art technology. Some specific technology and technique parts that could help as well the implementation of research. Of course, all these recommendations are not specific for childhood cancer, but we are bringing the message that yes, in our field, toward the objective of the BT Cancer Plan, this is something that should be improved. And this is why we say, next slide, let's make the GDPR child-friendly for research. Thank you, and I would like now to hand over to Delphine, who will comment further from a patient perspective and a parent's perspective. Delphine?
Yes, thank you very much, Gilles, for your introduction. My son was diagnosed with cancer in 2013 at the age of 8 years, and then he relapsed twice in 16 and in 19. So as I was preparing my speech, I realized that we had lived through the entry into force of the General Data Protection Regulation. And our first informed consent forms were clearly less detailed than the last one, And the last time, Rafael was also for the first time involved in the decision process because he had turned 15. I have to tell you, patients love the General Data Protection Regulation. We are deeply convinced that the privacy it warrants our data is fundamental, because this protection makes it possible, acceptable, safe for us to consent to sharing our data for research purposes. And we also place our hopes in research to improve existing treatments and our quality of life. And we're convinced that GDPR is the link that will help future patients to accept to also participate in research. As a result, this regulation is one of the best means to increase and accelerate data collection and, as a result, to advance research. However, as any new regulation, GDPR created frictions that had not been anticipated and that now we would like to see sorted out. The first hurdle we witnessed along the way is that informed consent forms are much too long and complex for most patients. Information needs to be adapted to its audience, and not only does too much information kill information, but also technical terms prevent patients from adhering to the project. If we want all patients to understand what the research plan is about, the plan needs to be laid out in plain language. There is also one reason why detailed and technical information forms are counterproductive. A very detailed explanation on the research project will never, by magic, turn a patient into either a scientist who can validate the quality of a research project, or into an ethicist who can distinguish morally sound research topics. On the contrary, patients want to trust researchers and funders in their capacity to identify what makes a research project relevant. And we want to trust ethical committees in their reasonable judgment to approve decent projects. But in the meantime, patient experts must be involved in those validation stages. What we really care about is that our data be fully protected and safely stored without any risk of leak to economic or commercial players who could use our data against our own interest. This is what we really want to read about in the consent forms. How will our data samples be protected, and if shared, in what kind of context? Sharing our data will always imply more risk than refusing to do so. So if we accept the risk to share, we really want our data to be used to their fullest extent. We want our contribution to be meaningful, and we hope to have impact. And we know that research today requires the creation of big data sets to discover patterns. Big data sets are important in all disease areas, but in the field of pediatric cancers, this matters to a wholly different level, because every single pediatric cancer is rare. Not a single member state can claim to account for enough patients to create a relevant database in pediatric oncology. We need those data to be shared across the countries and across the projects. As a result, data sharing must be facilitated. Instead, today, we witness barriers both at national and institutional levels. National privacy authorities have diverging interpretation of GDPR, and conservative legal departments from universities or laboratories find it easier to refuse data sharing because saying no reduces their exposure to liability. Patients and survivors would be surprised and utterly disappointed to hear that the data they donated could not be used to their full potential because they were not shared. Those data are samples of tumor or blood or tumor samples were given at a great cost for them. Let's make it count, and let's make sure that they can safely be shared to advance research. Finally, many survivors are now here to tell us that even if they were only kids when they underwent treatment, they would have wanted to understand what was going to happen with their data or samples, As from the age of 7, children can understand a lot if explained with simple words. And I witnessed that with my own son. No one, including myself, explained him what would happen to his amputated foot after the surgery. Out of the blue, he came back with a question a couple of years later. And I realized that we should have explained that to him at the time. When he asked the question, when he was amputated, he was 9, and he was perfectly able to understand. Child-friendly information should be available for patient age 7 or above, and they should be thanked, those children, for their contribution. GDPR makes it possible for member states also to implement an age of assent where young patients can express their own opinion on the treatment or the research project, as from the age of 13 years or more. But this rule fluctuated in several member states, and it's not uniformly implemented. This should also be part of the regulation. And everywhere in Europe, patients should have the same rights with the ability to assent from the age of 13. If we sum what I just said in a couple of actions, we want informed consent forms to be drafted in plain language. Patients do not intend to become the judges of the quality of our research projects. In other words, we care more about how our data will be protected along the course of the research life and in which context they will be used. The quality of a research project must be assessed by funding bodies and ethical committees, and patient experts should be included in those assessments because they have the tools for such a role and they can identify what really matters for the whole community. This should not be expected from newly diagnosed patients. Detailed and technical information forms can lead to a restrictive interpretation on how our data can be used, and this is exactly what patients want to avoid. As long as research projects are validated by experts, including expert patients, we want our data to deliver as much scientific progress as they can. We also want child-friendly information for patients above the age of 7. They should understand what they're going to do, what we are going to do with their body parts, and they should be thanked for their contribution to research. Finally, we want an harmonized interpretation of GDPR and means to avoid hurdles at the institutional and national level. In rare diseases, size really matters, and we cannot afford to lose opportunities if data cannot be shared to create bigger data sets. Thank you so much for your attention.
Yeah, I will hand over to Pamela Kearns, please.
Thank you, Carmelo. And a huge thank you to Gilles and Delphine for really outlining the issues in a very clear and emphatic way. My name is Pam Cairns. I am a pediatric oncologist, a clinical trialist, and the past president of SIOP Europe. And it is my huge pleasure to be chairing this second part of our meeting today, which is a panel discussion and a Q&A session on how do we optimize the GDPR to facilitate childhood cancer research. And we have a really excellent panel of speakers today, members of the European Parliament, European Commission officials, representation from the French presidency of the Council of the EU, representation from IARC, the International Agency on Research in Cancer. We've got academics, and importantly, we've got survivors represented on this panel. And I hope we're going to have a lively discussion and debate about the issues around GDPR. I'd invite all the participants. We've got nearly 190 people online now. That if you've got questions for the panel, please put it in the chat and we will get to them towards the end of the debate. But I'd like to start by introducing each of the panel members in turn and asking them to really comment on GDPR and comment on what they've heard from Delphine and from Gilles in terms of the recommendations to improve our current situation. And so it's my pleasure to start with an introduction of our members of the European Parliament, starting with Tomislav Sokol, who is a very active childhood cancer supporter. He is an expert in cross-border healthcare and was the substitute member on the European Parliament's former Special Committee on Beating Cancer, the Becker Committee. Mr. Sokol, We'd love to hear your insights on the importance of cross-border pediatric cancer research and what are the actions that we need to facilitate health data sharing across Europe. The floor is yours, Mr. Sokol.
Thank you very much. Thank you very much for inviting me to talk about this very important topic. We know that healthcare is primarily a national competence. Obviously, that's something that is often mentioned, but I think that there are many areas where European Union can actually provide an added value and resolve certain problems and issues and improve situation where member states cannot do it by themselves. And I think pediatric cancers, childhood cancers, are one example of an area such as this. So, of course, with pediatric cancers, I know the situation. I'm from a small country in the central eastern part of the European Union. These are usually very rare types or very specific types of cancer, and for which in many areas you just do not have enough expertise and enough local experts, enough local specialists to provide treatment. And this is a problem in many member states, and most of the patients who are sent abroad from Croatia to obtain healthcare in other member states are children. So this is one particular area where definitely cross-border collaboration is necessary, because in many member states for particular types of childhood cancers, we just do not have expertise, equipment, and everything that is needed, the resources that are needed to provide sufficient healthcare. And this is also something which is connected to what Manfred Weber said previously, is that we cannot have first and second class citizens in Europe. So we need a common European policy on how to resolve this issue of children from different member states not having access to the best possible cancer treatment that the European Union can provide. Of course, here there are many possibilities how to resolve this issue. One of these areas is cross-border healthcare, and I'm glad that in Becca report on the Europe's Beating Cancer Plan, we emphasized both childhood cancers, but also the necessity to simplify, make it easier to access healthcare in other member states of the European Union, to access cross-border healthcare. This is something that is definitely very, very important. Also, one thing which is part of the whole cross-border healthcare framework are the European reference networks. And these European reference networks are very important to provide different opinions and top opinions from top experts in Europe, especially for children who cannot, as I said, get maybe the best possible care, best possible diagnostic in their own member state. Also, cancer research is obviously one of the most important things if we want to have better results in terms of treating cancer. And I'm glad that we were able in the New Horizon program make cancer research one of the priority missions for investments from EU funding into research. So investments into cancer from European Union funding will definitely be improved also in the next phase. So these are all areas where European Union actually provides an added value, where we have seen the improvements in the last year or 2 years within this mandate of the European Parliament. Related to childhood cancer research, cross-border healthcare, etc. Of course, there are still many problems, and one of the problems is GDPR. And I listened carefully to the results of the study, and I think this corresponds to things that we thought and the position that we had in European Parliament about this. Especially so the problem of the fact that we have different interpretations of GDPR in different member states, and this creates a lot of problems during practical implementation. And from the data that I saw, I think around 75% of health professionals which were interviewed said that data sharing has become more difficult after the adoption of the GDPR. 70% said that clinical trials have become more cumbersome, and 50% that discovery and translational research has also become more difficult after the GDPR. I think there are different reasons for this. I think the whole concept of having such a revolutionary legislation to apply in this broad horizontal manner, but by all actors who deal with data, so not just the state institutions institutions, but everyone, is something that that was maybe not the best solution at the time. Because definitely, because if you have hundreds and thousands of different institutions who have to implement something in 27 different member states, definitely that you will have different interpretations, different opinions, different ways of understanding certain provisions of the GDPR, etc. So, but now, so this is the first thing. So this kind of revolutionary legislation to be applied in such a broad horizontal manner was logical that it will cause problems. So this is definitely a problem. We see this in practice. We see this in healthcare. We see this in education, in higher education. I know because I teach at university, and I can see this some very, in many cases, ridiculous interpretations of what GDPR means and how we have to protect data of students and things like that, also of patients. So this is something that is definitely a problem in many areas. So I listened carefully and I read the recommendations, and I think there are three of them that I would like to highlight particularly. They're all important, but I would like to highlight the three which I think are particularly important. First is the uniform interpretation in different member states. So we need a kind of guidance from the central level, from the European Commission, to provide some kind of additional interpretative tools so that we really know in practical situations how to have this common approach. Because if we have 27 different approaches in 27 different member states, then we didn't achieve what we wanted with GDPR, that was to harmonize this. So we wanted to harmonize data protection legislation across Europe, that we do not have different standards which result in first and second class citizens. But now, unfortunately, because there's different interpretations, we have this particular problem. So I think this is something that definitely should be addressed. The second is about possibilities to get the broad consent in certain issues. And I think that in practice, especially medical practice, this is something which is very important, because in many cases you just don't have the time to go through everything that is required or which is interpreted as being required from the GDPR. So I think we need some flexibility there. I think this is very important, especially, and I think that we have to interpret rules in a teleological way, which means we have to look at their purpose. So, and we have to be careful that too restrictive interpretation of GDPR does not lead to worse health outcomes, to postponement of certain diagnostic and treatment, etc. Because then the whole thing is definitely then we achieve an opposite purpose to the purpose that we wanted to achieve in the first instance. And the final point I think that is also very important are third countries. So relationship with third countries. I think European Union is very proud of having very high standards, the highest probably standards of data protection in the world. But now within a globalized world, with having many transnational clinical trials and research and pharmaceutical companies, which are multinational companies, which use this data, so we have to engage these other countries, especially those countries which are similar in terms of protection of democracy and rule of law, etc., to Europe, and try to find common solutions with them. Particularly, of course, I mean the United States. So I think that this cooperation is very important, because if we do not achieve to have similar standards there, then it will be very hard to conduct many things in terms of research, in terms of development of new medicines and new treatments that we want also to have in Europe. So I will stop here. So you have my full support. European Parliament has always been at the forefront of providing new solutions in healthcare and actually strengthening this European dimension in healthcare, and we'll continue to do this. And I look forward to future legislation that will come from the European Commission. I think when we speak of data, the first one will be about European health data space, which should contribute to reducing the differences and achieve interoperability of data between different member states. So this is also something very important, and I hope that also in Europe that we will be able to develop this common framework on how to use data in the best possible way. Thank you very much.
Thank you very much, Mr. Sokol. That was very helpful and highlighting the importance of the uniform interpretation, a little challenge to the Commission. We'll come back to that when we talk to our representations in the Commission. The importance of specificity of data use, depending on the type of data. And your final point about the third countries, I think was welcome and answered, I think, some of the questions in the chat. And so with that, I'm going to hand over to Mr. Cyrus Angereux, who is our second member of the European Parliament, also a continuous supporter of childhood cancer on the EU agenda, and is a member of the European Parliament's Committee on Environment, Public Health and Food Safety, the ENVI Committee. He's also a substitute member in the Committee of Civil Liberties, Justice and Home Affairs, and a former member of the Beating Cancer Committee. Mr. Angereux, we'd like to hear your insights on the implications of GDPR in health research and how we will optimize health research data sharing. Thank you.
Thank you very much, Pamela. And I would also like to take the opportunity to thank the European Society for Pediatric Oncology for inviting me here today to discuss a topic which is so important to me. Let me start off by being very clear. I am a human rights activist and I'm a human rights advocate, and I believe that data rights are today, in this day and age, an integral part of human rights. More so, I believe wholeheartedly with the principles of data protection, lawfulness, fairness, transparency, purpose limitation, data minimization, accountability, security, integrity, confidentiality, and a plethora of rights that come with it. But all of this should never cost us the ability to share crucial, important, and life-saving data within the medical field. Health research is crucial for us all. It empowers the medical community, benefits individual patients, and strengthens our healthcare systems. Dare I say, health research underpins social cohesion and stability and allows medical advancements to foster in very impressive ways. However, over the past years, the establishment of and implementation of the EU's GDPR has led to the creation of major barriers and challenges when it comes to the sharing of health data. Under the current legislation, foreign institutions are unable to transfer important data, and researchers are unable to remotely access essential information for collaborative research. This constitutes a very, very big problem for the medical community, both in the private and in the public sector, and effectively for patients as a whole. We pride ourselves on the ability of our member states to collaborate on research. We boast about having the ability to utilize the greatest minds across our 27 European Union member states to come up with European solutions. But if the legislation we have in place deters this from happening, then the European Union itself will be its own undoing in this field. I want to tell you the story of a child whose family I met. She is 8 years old. I'll call her Maria for the purposes of this discussion today. Maria and her family live in a very small village in Slovenia. She has fair hair, porcelain skin, big bright blue eyes, and recently she was unfortunately diagnosed with uveal melanoma. Although uveal melanoma is the most common primary intraocular tumor in adults, it has a mean age-adjusted incidence of only 5.1 cases per million per year. 1% of these patients are children. This means that Maria is likely to be one of the only children who has developed uveal melanoma, not only within her region, but within all of her country. It is indeed a very rare disease, like all other diseases in children are. Those who are taking care of her in hospital in Slovenia, and the different hospitals in Slovenia, and outside of her country, must have all the data and research possible in order to be able to give Maria the best possible treatment and care. However, with today's legislation, it is very difficult for her medical carers to be able to do what is best in her particular situation and circumstances, because data sharing and the implementation of the law in different member states is being done totally differently. We need one method of implementation and we need one interpretation. Before I conclude, I would like to speak a little about the results of the survey on the impact of the GDPR regulation on childhood cancer research in Europe, undertaken by your organization excellently, I must say. It was evident from the survey that the vast majority of oncology professionals face difficulties in health and research data sharing, and that such information has become even more challenging to obtain since the GDPR's entry into force. There is no better way to understand this issue than having the opportunity to listen to real-life examples, as we have had today, from professionals and patients whose main aim is solely to save their patients' lives. This is exactly the type of feedback that we need to understand how this issue is truly affecting people's lives. Human rights are something that I have always strived for throughout my career, and so it goes without saying that human health should always be given the priority it deserves. It is therefore imperative, as per the recommendations of the survey, that there is a harmonized implementation and interpretation of the GDPR across all of the European Union, so as to make sure that data sharing, when it comes to health issues, is always ensured. To conclude, we need solutions to this. We need a solution for Maria, and in childhood cancer, this is even more so important. Children are some of the most vulnerable persons on the planet. All pediatric cancers, as you have already said, are rare diseases, and we are this week in Rare Diseases Remembrance Month, and we have a duty to protect them. We need to reevaluate their side of the story, and we need to start recognizing that while children's data rights are indeed very important, their physical and mental well-being is so much more. That is why I thank you for organizing today's conference, in order to put this topic high on the European Union's agenda, in order to raise these issues with decision makers at large, and above all, we need to get the ball rolling for legislative change. So I thank you very much once again, Pamela, for hosting also this part of the session. Thank you.
Thank you, and thank you for those very important words. And I think it's really important to hear the emphasis of the balance between human rights protection, but also not a rule that makes it difficult for us to implement good healthcare data sharing. And I think the theme of harmonization is definitely coming through all the presentations. So with that, I'd like to turn to our members of the European Commission for their comments, and starting with Owen Langfeld, who is a legal and policy officer working in the data protection. Oh, excuse me. Apologies, I just lost my screen. Who's working in data protection within the European Commission's Directorate for Justice and Consumers. Mr. Langfeld, it would be really helpful to hear your perspectives and the perspectives of DG Justice on the GDPR's legal framework and how it's been implemented in health research, and your comments on the GDPR survey results and the recommendations that have been formulated. The floor is yours.
Yes, thank you for having me. Yes, I'll quickly go through a couple of few slides I have here and then react also on what has been said before. So we can just go, please. Next slide. Basically, what are we talking about for data protection? In general, it's the code of the road to ensure that people are protected when their information is processed. And indeed, like MEP Sokol said, in a way, a teleological interpretation. And what we have as the kind of overarching framework in the recitals there is the processing of personal data should serve humankind. And that goes through it as well. One point that I always want to make, it's actually not much of a revolution, it's an evolution. Most of the principles were already there in the preceding data protection directive from 1995. Many go back to the Council of Europe Convention 108 from 1981 still. So it's an evolution, not a revolution. So applying this in the specific context here, next slide, please. We've talked about lawfulness and the conditions for processing. There are a number of different legal bases for the processing of personal data in GDPR. It's not only consent. And what sometimes has also caused issues in the past, and we have seen guidance also from the EDPB, the European Data Protection Board. I'll come back to them in a minute or two, on the distinction between data protection consent to processing and the informed consent in the medical sense to a medical intervention or also to research involving human subjects. Mr. Vassal mentioned one-time consent or broad consent, where processing is in fact based on consent. Under GDPR, it needs to be specific, informed, and freely given. But explicitly in the context of scientific research, recital 33 of the GDPR offers a bit more flexibility there in the field of scientific research, because indeed sometimes the purposes may not be clear in the beginning. Think of a consent-based register of disease or of health information, where obviously at the moment of setting up the register, the purposes of each specific project using the data afterwards can't be known yet, but there is some flexibility for that. And also, and this came through in several remarks as well, and also when Commissioner Kyriakides in her address at the beginning talked about how the European health data space will provide the safeguards for further processing for research purposes. This is what we have in Article 9.2.j GDPR, that's the article on specific conditions when sensitive category or special categories of data, such as health data, can be processed, and that can be done in that case if it's necessary for scientific or historical research purposes or statistical purposes based on laws which provide for suitable measures to safeguard rights. And some of those safeguards will also be in then the EHDS proposal when it comes out. On EHDS, I won't talk more because that's for Jérôme, just after me, my colleague from DG Sante. A footnote or small note on different approaches in member state. GDPR indeed leaves a possibility for member states to have additional rules in the health field. As was also mentioned earlier, the organization of the healthcare systems is very largely a member state competence. So that acknowledges this, and there can indeed be differences between member states. Next slide, please. But as mentioned, GDPR does acknowledge that research indeed can serve humankind, and therefore research is in some parts of the GDPR privileged over other reuses of data. On a practical compliance question, and here I think we're also all on the same page. One key principle of GDPR is transparency towards the data subjects, so the people whose data are processed. Delphine Heinen mentioned that in her intervention, that her son would also have liked additional information. This is something that indeed people need to be informed, and GDPR also specifically acknowledges that when it comes to children, the information needs to be adapted to them. So to have, for example, shorter or easier versions of the information. Next slide, please. Now, one thing that almost everybody said, we need more harmonization, more guidance on how to interpret GDPR. The main body that would do that is the European Data Protection Board, i.e. the body in which all the national data protection authorities from the EU member states cooperate with each other. They have tasks on enforcement cooperation, but also on providing additional guidance. We have also, as the Commission in our report on the evaluation of the GDPR published in summer 2020, seen, and this was also part of the feedback received, that there is a need for further guidance on the application of GDPR in the research field. In the report, we called for the EDPB to provide such guidance. We have sent a questionnaire of things that also in our own activity when funding research projects came up. The EDPB has already provided some first indications there, but most importantly, it is working on guidelines that will address issues such as the broad consent, question on secondary use, how to inform people in cases of indirect collection, etc., and so on. They already did a stakeholder event last year on collecting information, and these guidelines are expected to be issued this year. The always general approach there is that they do provide a version for public comments, and then after these public comments, that get updated and then adopted. So when that comes out, of course, you are all more than welcome to provide additional input there into the guidance to be provided there by the EDPB. And they should really address both many of the points that Mr. Vassal made, also Ms. Heenen on information on further use, and that to indeed move more towards a approach where it is indeed one regulation, one interpretation, and it is really for the EDPB to provide that. On that, I'm sorry I ran over time, but I wanted to already react to some of the points made earlier, and that is it from me then. Thank you very much for your attention, and on to Jerome.
Thank you very much, Mr. Langfeld. And actually, I think it's really important, the work of the European Data Protection Board and these guidelines, and it will welcome this consultation process. I think one plea from me, aligned with some of the comments of Delphine, is that the guidelines are written in a language that everybody understands, because I think that helps with the misinterpretation if we all actually understand it. But I'm going to hand over now to Jérôme de Barros, who is a policy officer working in digital health and has been involved in the European reference networks within DG Sante, the European Commission for Directorate General for Health and Food Safety. Mr. de Barros, we'd love to hear your insights on the potential of the European Health Data Space Initiative and how that will facilitate health data sharing, particularly for pediatric cancer, as well as interactions with the implementation of GDPR. Over to you, Mr. de Barros.
Thank you, Pamela. Thank you, everyone, for the kind invitation. So I think I will clearly explain the way in which GDPR really provides some important safeguards on the right of individuals over the health data. But we have also heard from Delphine, from Gilles, in practice, that we are indeed witnessing this fragmented and diverse legal and administrative rules across Europe when it comes to the access to the data, the standards, the infrastructures that really do not allow for really the effective implementation of those provisions so that every individual can have access to their own data. On top of that, we can see that the possibilities that are offered by GDPR on the reuse of health data have not been interpreted and applied equally across the member states, as has been stated before in the previous talk. So this just really makes cross-border studies research too difficult for researchers to really comply with the different requirements in each of those jurisdictions. So our conclusion is that Europe urgently needs to introduce additional health-related safeguards to ensure EU citizens have strong rights over the health data, but also to fully harness the potentials that could come from the reuse of that data. So our answer is what we call the European Health Data Space Legal Proposals and its associated legal research infrastructure. It is one of the highest priorities in the current College of the Commissioners in the area of public health, and it is an integral part of what we call building a European health union. So it marks a new beginning for empowering the rights of individuals over the health data and to unleash the potentials of the data economy. So by using the health data for better policy making, better research, in particular, as the most relevant for you here, to address areas such as childhood cancer, of course. So in practice, the legal proposal aims to achieve timely and simplified exchange and access to health data for different use cases. First one is primary use, so to support healthcare provision and to facilitate access and control of patients and citizens over the health data. But also secondary uses was more relevant for you: research, innovation, regulatory purposes, and evidence-based policy making. And for that, we will be addressing several aspects. First one is governance and the legal provisions. We want to ensure coherence with a number of existing legal frameworks, like GDPR, obviously, but also the Data Governance Act, the AI Act, cybersecurity regulatory purposes. There's a whole framework of legislative frameworks that are ongoing that we need to comply with. Medical regulations is another one that is obviously very relevant. We will also look at the quality of data. We need to make it easier for researchers to be able to identify relevant data sets for them and making it easier for them to place a request to access this data, and making sure that they quickly identify the ones that really identify their needs and make that this data set is available in the adequate format. We need to make sure that this access takes place in a secure environment. Now, respect to privacy of individuals. For this, we need an infrastructure that builds on existing one. Some member states do have one. We do have EU-level research infrastructures as well that provide this framework. So we need to make sure that they all compatible, that they're interoperable. This is something we'll be looking into. We will also look at capacity building. So we want to foster cross-border cooperations when it comes to, for example, training, to best practices. So you mentioned a very important example with the European Reference Network was the ERNs, a very good example of that. And I know that later today, you will hear about one of those, so PETCAN, which is a ERN that focuses on rare childhood cancers. And I'm sure some of you are already familiar with. So in practice, what we really want to achieve is really close cooperations between patient associations, healthcare providers, professionals, researchers, policymakers, and for that we obviously keep on engaging with everyone. We, the Commission, are working, as was mentioned here, to present a legal proposal in the spring of 2002, and we're already starting activities, for example, through one of our programs called EU for Health to really make this start in place. So looking forward to reply any questions you might have.
Thank you, Mr. de Barras, and putting a time framework on it is brave. So spring 2022, so we can look for
to go to our colleagues in the European Parliament and the European Council. It will take much more time for it to be implemented, but this is our objective in the first place, at least.
Excellent, thank you. So now I'm actually going to turn now to somebody who's at the sharp end of trying to grapple with the GDPR. And it is my pleasure to introduce Dr. Eva Steliarova-Foucher, who is a scientist working on cancer surveillance within the International Agency for Research on Cancer. Eva, you're very welcome. And we'd really like to hear your thoughts and experiences on GDPR implementation in your field in population-based pediatric cancer research.
Thank you very much. Thank you for invitation, members of parliament, childhood cancer advocates, colleagues. I'm really privileged to speak at this forum today and add another point of view to complement the excellent contributions by the previous speakers. The agency has a mandate from the World Health Organization to provide global indicators on cancer burden. We are located in France, but not subjected to regulations of the European Union. At IARC, I coordinated international studies of childhood cancer over the past 25 years, with data contributed by hundreds of population-based cancer registries around the world. This period was marked by two contradictory trends. As more and more data were collected in more and more countries, they became less and less accessible. In the past, we could work with exact dates of patients and true morphological types of tumors as they were described by pathologists. But these days, we must work with approximate dates, grouped morphology types, and other restrictions. However, this is still a relatively good scenario because some European countries can only provide group data for large enough categories of patients. So apart from losing granularity, aggregating information strips everybody of a chance to learn, because comparing detailed data from many countries helps to improve data collection, quality, and completeness everywhere. And quality is crucial when we study childhood cancer, because each single case weighs heavy in the total. You may know that the current estimates of the global childhood cancers are based on less than 15% of the world's population of children. Most of these covered populations are in high-income countries. But since GDPR implementation, these data also become rare. For example, we could not include Denmark and Finland in the global compendium of childhood cancer incidence data. Currently, we are conducting an international study of cancer risk in childhood cancer survivors. Through Children with Cancer UK, funds come from people who believe that research can conquer cancer in their children. This research is now impeded by the rules which are meant to protect the same individuals. For example, the Nordic countries cannot send individual cancer records at all. In other countries, we can sign agreements to obtain most of the required data items. So we and our collaborators study legal texts, films, negotiate conditions, and devise strategies to obtain sometimes slightly disguised individual records. All these digressions from research waste time and money, which was so hard to raise. Interestingly, data still can arrive from some European countries, anonymized, protected, but without additional administrative burden. This shows that GDPR is European law, which has different meaning in different member states. To overcome data sharing obstacles, we are advised to use federated data analysis. However, these experimental methods are expensive and difficult to put in place. I remember my professors of medical statistics often warned us, talking about data, what comes in, comes out. Meaning, if we cannot get hold of real data, we cannot produce real results. So along with many colleagues, I fully support the recommendations of this forum. If we want to use population-based research to inform policies, data collection cannot be subjected to consent or a withdrawal right of an individual. If we want to have internationally comparable data, we must share individual records within and outside of Europe. If we want to control cancer in childhood, we must share all details of all patients. So I would like to end my talk by thanking the organizers for this event, possibly the most important since the launch of the GDPR. GDPR made us understand the importance of data protection, and now it is the time for GDPR to take on board the value of data for research and for all of us. Thank you for your attention.
Thank you, Eva. Listening to you, I was wondering if you have ever added up the number of hours you spent looking at legal documents, trying to understand the different interpretations in the different countries that you collaborate with. Perhaps it would be quite a scary number. I'm going to now turn to somebody else who's also got enormous front-end experience on the impact of GDPR, and it's my pleasure to introduce Professor Ruth Ladenstein, a colleague and friend and board member of PSYOP Europe, and she's also the coordinator of the European Reference Network for Pediatric Cancer, the ERN PEDCAN. Ruth, you wear so many different hats, including being the coordinator of ERN PEDCAN. From your perspective and from your experience, can you outline how the GDPR has impacted on your research?
Thank you, Ben. Thank you for giving me this opportunity to speak up today. I think just as an introduction, I think it would be absolutely paramount that we find ways of a seamless data sharing process across the EU member states and beyond, and particularly within institutions, to really realize the scientific progress that is so needed in childhood cancer research. For me, a very special issue is really privacy keeping data linkage, because this is really of utmost importance for comprehensive and really goal-oriented research to develop really these tailored solutions for children and young people with cancer. I would like to give very briefly examples. And it's heartbreaking on the one hand that the EU invests in fantastic projects and supports smart people. And ultimately we fail to implement or to do what we want to do. And I'm part of one project, for example, that tries to advance research and implement artificial intelligence for better diagnostics and ultimately also treatments as a guiding tool based on artificial intelligence. And what you need for this are images. And it was the most painful process ever that we are going through, and we are largely delayed just to get images from hospitals. And this is all related, and it stops at the hospital firewalls or data protection concerns that they are not allowed to give away people. We found many ways to circumvent this, introducing a privacy keeping record linkage pseudonymization tool. But ultimately, these exercises are extremely time intensive, cost intensive, and we are far behind our estimates what we could gather, because we have a very rich clinical database. And currently, I think we gathered about 10% of the images, yeah? And it could be so much more, and we would have valid readouts, but we are really pushed back by the current interpretation. So I think I just can underpin that a uniform interpretation and guidance, yeah, raising a new awareness, what we want to achieve in Europe, would be absolutely paramount. I think if we really want to walk these new avenues in research, which are fantastic by principles and the means are there, we really have to try to get a new understanding and interpretation that we really can optimize research and really gain these insights, which really fosters the better diagnostic and treatments, and ultimately may create an equity across Europe. Because just to underpin once more, this data linkage is so important. We have a rich history of clinical trials in Europe working together for decades. So we have a lot of data where we understand the treatments and where we do have the outcomes. And there are bioresources, biobanks out there. But really now to have a new research with new insights, new biomarkers ongoing, having images on the other side, we could do fantastic things if we are smart enough to create a common understanding how to make happen what is possible. So I hope all this will not be a mission impossible, but possible. And with joint forces, we may create a better understanding in Europe for this. Thank you.
Thank you, Ruth. I'd love to think this is mission possible. Very well said. And I think you highlight that really important point that this is not about anonymized data. It's about data linkage and about pseudo-anonymization, which creates even further complexity interpretations. And with that, I'm going to hand over to Professor George Astras, somebody else who's at the heart of trying to data share in the field of health research. Professor Astras is Director of Medical Oncology at the American Medical Center and the Platanos Medical Center in Cyprus. And Professor Astras, please tell us your insights on the challenges and opportunities in health data sharing in Europe.
Thank you for the invitation. I might actually add excellent speeches and points by everybody. Let me start. The European Reference Network on Pediatric Cancer Project states that its aim is to ensure accessibility to quality treatment for all children in the EU, including clinical trials. And let me stand on these three words: accessibility, quality for all children. What is important here is the data, its quality, and the amount of data. And although GDPR has made many doctors weary and reluctant, there are ways to make the clinical trial process and the data sharing more streamlined and accessible to all cancer clinicians throughout Europe. Safe, reliable, and large amount of data opens the gates for us for many clinical trials and questions, which in turn help us make new assumptions, and thus new cancer care pathways are born. There are no bad clinical trials. Even the negative clinical trials have something to teach us. They tell us what to avoid and where to focus more. But there is one thing we dislike about cancer care in Europe: the lack of access to clinical trials, both for adults and children, and the inequalities of cancer care and treatment access that leads to 20% difference in survival rates for children with cancer among member states. Europe must be unified against cancer, and it needs a high level of coordination at the local and pan-European level to make this a reality by the creation of local pediatric cancer committees that will facilitate this harmonization effort. Clinical trials, especially pediatric clinical trials, which run low in numbers in comparison, must be unified throughout Europe to provide clinicians access to them for the benefit of the little patients, while ensuring that the quality of the care and the quality of the data is maintained. This is important because we should enable children to have their children in their own country, in familiar environments, while receiving excellent and centrally coordinated cancer care in the company of the friends and family. I hope that you all understand that the psychological impact for a child and the family during these times is enormous. Personal data can be anonymized or coded at European level, and thus scientific data can be easily shared without GDPR issues. But at the same time, local cancer clinicians can see and identify the patients easily. We have done this before with IT and software platforms. Specific logins allow specific access to specific parts of the data, depending on who the user is. This will ensure access to clinical trials to all countries of the EU. The primary investigator will control the scientific data, its quality and data sharing, and the individual oncologist will have access to the patient's data, and more importantly, we must also provide access to the patient's own records. Creation of a unified identification number for clinical trials per patient data will speed up enrollment into clinical trials and make suitability to the clinical trials easier through a simple database research. It will also make the unified consent much easier. For example, a trial investigator in France can run a database search and find all suitable candidates throughout Europe for his clinical trial and offer them enrollment at the local level, while he will be centrally in control of the data and the quality of the trial. In pediatric cancer clinical trials, numbers matter. Solutions exist. GDPR harmonization and unified interpretation is essential. So let's dream of a unified cancer care that has no borders, that enables and doesn't hold back, that cares and doesn't fear or GDPR. Thank you.
George, thank you so much, and highlighting the importance of the impact of GDPR on delivery of clinical trials in multiple countries. It is a challenge, and for our legal people on the panel, we can debate for months over a contract on who's the controller and who's the processor, because every country thinks that every institution interprets that differently, and that holds up clinical trials. With that, I'm going to hand over to our final panel member, and I have to say, last but really not least, it's important to hear from Zuzana Tomaskova, who is a survivor representative. She is a member of the CCI Europe Committee, and she's also the survivorship lead within CCI Europe. Zuzana, can you share with us your thoughts on patient consent, reconsent requests from a family perspective, and what does this whole data sharing debate mean to you and to the childhood cancer survivors that you represent?
Thank you very much, Pam, for this opportunity. to represent childhood cancer international Europe in this meeting and especially bring up the patient and survivors perspective. I signed my patient consent more than 15 years ago, so long prior to the GDPR. However, I could not agree more with all the arguments and proposed action that, among others, my colleague Delphine mentioned in her speech. I was 19 and I don't remember anything from that time besides that feeling I should sign it, and I had not made any claim on myself to understand it. I fully trusted the doctors around. I wanted to start my treatment and I was willing to help. I wanted to support research because I was aware of the fact that my treatment was also developed thanks to the research based on other patients' data. My perception within the parents and survivors community is similar to my personal experience. There is indeed big trust towards the healthcare professionals and a broad willingness to share data. At the same time, if the patient or caregiver is already insecure, confused, or overwhelmed by the situation, having to sign a consent that is not easily understandable is even further decreasing the confidence into the relationship between the medical team and the patient, as well as decreasing the chances to share the data. Cancer diagnosis is a big shock. There is a lot of information brought in a very short time. Decisions have to be taken and there is no time to digest them. All this emotional like roller coaster ride. Maybe a relief having finally a diagnosis with consequent treatment in the sight, but also a fear what such a diagnosis actually means. I strongly believe that a patient consent in a plain language, explaining the main aim of the research as well as how well the data are protected by the given consent, would improve the relationship and communication between the healthcare professional, patients, and their caregivers at this crucial stage. It will also empower the patient and parents being able to take informed decisions, which hopefully leads to ensure the essential data contributions. Furthermore, informing children and adolescent patients in an age-appropriate manner, involving them into the discussions and decision-making process regarding the patient consent might lead to the discussion about the reconsent at adult age being redundant, at least for part of the patients. Looking at the survivor situation, there is almost 500,000 of childhood cancer survivors in Europe, many of us dealing with late effects due to the treatment or the cancer itself. In order to improve our quality of life, as well as for all the future patients and survivors coming, we need to further increase our knowledge in the regards of the late effects. I should not be repeating the facts, but being a part of the rare disease community, our only chance to advance research is by sharing and collecting data across borders. We cannot afford to start by zero from now on. We need to profit from the data which has been already collected in some of the registries since over more than 40 years, and we need to find a way how to make those data available for international research. We also need to ensure that the data collected in the future are of high quality and are comparable. As a patient expert involved in several international projects, I have to admit it's really frustrating to see so many dedicated people wasting their resources just by discussing for hundreds of times how the respective legal department is interpreting the new or rather new regulation on its own. In our perception, it's indeed the huge variety of interpretation and implementation of the GDPR which makes the sharing of the data partially impossible. Once patients have consented to sharing their data, they want their consent to enable as much research as possible. Sometimes one can have the impression that GDPR even seems to be misused as a nice excuse to prevent collaboration. We need to act now. It's not the interest of the individual survivor being approached every 2 weeks by another research institute to give a consent for a further research question, nor that his or her data is grounded in a data silo without further added value. GDPR is an important regulation which is crucial for the childhood cancer patients and survivors, ensuring their privacy when it comes to such a highly sensitive data asset as their health data. However, to unleash its full potential, I do strongly support the recommendation presented by Professor Gilles Basal to harmonize the GDPR interpretation and implementation across Europe. Additionally, I would like to emphasize the importance and chances of providing a patient consent in a plain language and involving the children and adolescents in the discussion of informed consent. Finally, I would like to stress out that the important role of parents and survivors organization, providing patient experts who should be involved in the assessment of the research project, and so ensure that the patient's interests and needs are consequently taken in account. Moreover, we are more than happy to help to develop a new version of a more patient-friendly informed consent. Thank you very much.
Thank you, Susanna. That was really excellent. And just following in the chat, I think the endorsement of both your message and Delphine's message and how important it is to take into account the views of patients, parents and survivors. So thank you for that. Now we have just about 20 minutes for questions. I'm not sure we can get through them all. And I rather am concerned that so many of the questions are being directed at the Commission, so you'll be busy. But maybe if I could start with I don't know if you want to pick this up or Jerome. There's a question really about lessons learned here from Erica Murphy. Were concerns or recommendations about the GDPR taken into account that were raised already by the research community and the pediatric oncology community? And I guess this is really a question of, are there things that could have been avoided? Well, we don't want to just look at the retrospectoscope, but will these lessons be taken into account for the revision and for the guidelines I think that you mentioned were coming out?
On the legislative history, admittedly, that was a bit before my time here in DG Just, but I can tell you that, of course, such a regulation as this GDPR doesn't fall from the sky fully formed in one day. It was adopted by Parliament and Council after indeed 4 years of discussion. The Commission proposal came out in beginning of 2012, and that in turn was preceded by public consultations on what did and what did not work with the data protection directive that we had before, dating back from the mid-90s. So of course, concerns such as from the research community were also aired at the time and are reflected in certain provisions in the GDPR, such as the acknowledgement of this broad consent in recital 33, the presumption of compatibility for further processing for research purposes. So it has fed in there. Now, if we're now on the level of practical implementation, I hear the calls for further guidance and further clarification. That is indeed, as mentioned, a task in the first place for the European Data Protection Board. And they have also heard these messages, for example, in the stakeholder event that they have carried out last year. So these guidelines should help both on the aspect of legal departments in research partner A and research partner B having different interpretations. It should provide a harmonized line there, but of course also on the level of then the national data protection authorities, because they say, while these guidelines are formally speaking guidelines, of course it will be difficult for any national authority to go against the guidelines that they themselves have agreed upon on the European level before. I mentioned the research guidelines, but since it was also mentioned on pseudonymization, anonymization, where to draw the border, so to say. There are also guidelines on that in the pipeline, which should also be out this year. So there is further guidance coming there, and I hope this will clarify, or I'm confident this will clarify many of the practical questions of application. Thank you.
Thank you, Owen. And if any of the other panel members feel they want to jump in on any of these questions, please put your hand up so we rescue the Commission a little bit in all these questions. The other question that has come up, and I'm going to paraphrase because it's been put in lots of different ways, is the issue of collaboration with third countries, and what's the mechanism to ensure that will be possible? How do you influence the third countries? How do you ensure data sharing is going to be as simple as possible? There's a number of different questions from different angles, but that's the nub of the question. Jerome, do you want to take that?
This is perhaps at least one of the other questions about the legal proposal, EHDS legal proposal being the silver bullet. This is perhaps one of the aspects that is not covered. What it will cover is data sharing and data access within the European boundaries, within the member states, and with union bodies. But perhaps by setting a framework for our countries, will be in turn put the pressure, but help other countries to find a way to be compatible with the provisions we'll be putting in place. So this is not at least an element part of our legal proposal, if it's to answer directly to your question, really.
And can I stay with you, Jerome? It's a very specific question to you, asking whether you believe that the EU health data space will solve the majority of problems. The question is it a silver bullet?
Going back to that point, this is an example where indeed the legal proposal will address, but let's take, for example, an element that came up very often in conversation by Susanna, other intervenients, about consent. Owen can tell you more about it, but the Data Governance Act, for example, has a set of provisions when it comes to the rules for data altruism, how to let patient citizens share their data. So this is something we, as I mentioned before, our legal proposal will have to be compatible with, aligned with, so not addressing directly, but rather complementing.
Thank you. There's a question, it's a very specific question from Anthony Moorman about, he's a leukemia researcher from the UK, and he's been involved in a European project called the Harmony project, which you may be familiar with. It's an EU IMI funded project, and they collected 100,000 patient data sets, but tackled all the GDPR issues. And the question is, how can we learn from those researchers that have actually tried to solve the problems? Ava, I think, is probably somebody who's very much at the heart of that. While we're waiting for change and while we're waiting for the guidelines, is there anything we can do to learn from what has already succeeded and the challenges that have already happened? Maybe Ava, you might want to comment on that.
Yes, so we are trying our best. We are signing those agreements. We are examining how to do the federated data analysis, but these all are sort of implants instead of real limbs that we can have real in terms of data. So yes, it would be great if there could be improvement in data sharing possibilities, including outside Europe, because Europe is big, but it's not big enough to tackle cancer in children. Thank you, Ava.
If I may ask, I think I understand where the question, especially about the overlaps that were mentioned in this question. So obviously my intervention was about the legal proposal, mainly is linked to the GDPR. I did mention an infrastructure, and what I want to make quite clear is that such infrastructure would not be a central repository of any kind. The idea, what I mean by infrastructure, is a set of it is an infrastructure, but it is to link existing repositories. The idea is to build on what's existing. We do not intend to replicate, duplicate what's already existing. So we want to link existing repositories. We want each member state to have an authority, a legal authority body to facilitate this data access. So by any means, repository created in European projects at national level will be part, ought to be part of this network as they are, and by no means duplicated at a central level or European level. So I hope this clarifies the question that Dr. Moorman might have.
Thank you, Jerome. I think, Owen, did you want to come in on that? I thought I saw your hand.
Yes, I can maybe say a few words on the international transfer as an outside EU/EEA aspect. There, there it follows the general approach in GDPR, meaning that the same instruments that are available also for use, for example, by businesses in their own activities, are available here. I'm not going to do the, let's say, full rundown of all the possibilities. The short version, and let's say what can be split, especially relevant here, is on one hand the so-called adequacy decision, meaning that certain third countries have been recognized by the Commission after opinion from the EDPB as providing a basically equivalent level of protection. Those third countries are then, for the purposes of transferring personal data to them, treated essentially the same as a member state. One example, the UK, for example, since obviously for reason of having been in the EU a long, long time, its data protection rules are still basically aligned. So on that, from the GDPR perspective, it shouldn't matter whether you have a cross-border project between France and the UK and France and Germany. That is one thing. So there's a list, admittedly not very long, of third countries who have been recognized in this way. The other thing is that in the last summer, the Commission has published a new set of standard contractual clauses that can be used to adduce the relevant safeguards that are required for transferring personal data outside the EU. So those are some of the tools that are available there. Thank you.
Thank you, Ara. That's great clarification. I've got a question here from Kathy Pritchard-Jones, who's the current president of the International Society of Pediatric Oncology. And she's asking the EU officials, maybe we could ask our MEPs to give the Commission a bit of a break. They're looking for advice on what's the type of evidence and advocacy that is most likely to help make positive change to facilitate research. So, for example, demonstrating the lost research money that's been diverted in trying to deal with interpretations of GDPR rather than the research. Are these data helpful? Perhaps I could direct that to either of our MEPs on the line. Actually, I've lost them off my picture. Perhaps, sorry to come back to you guys, Jerome or Awa, would you like to comment on that?
Okay, I can. On kind of what kind of advocacy or information can help. I mentioned that the EDPB will go through this public consultation procedure. On that is then really a call for stakeholders in the research community to contribute there, to also draw attention to specific examples, specific use cases. Usually these guidelines use a couple of illustrative examples. So this comment phase is also a an opportunity then for you to make sure that the main use cases or the main issues that you face are addressed. And that would also make the use of those guidelines for you afterwards a lot easier if you can tell a legal department that raises an issue. But what we have here is the situation in example 13, and this should be the answer. And yes, we can do it.
Thank you. I have to say that in a lot of the questions are really, they understand what's being proposed and the recommendations being made from CCI Europe and SciP Europe, and the plans that that you've outlined, and the support actually has been really positive. I think the frustration is, what can we do now? People are researchers who are working now trying to navigate the GDPR, and the question is there a short-term way of trying to get a bit more alignment between the member states? I suspect there isn't a good answer to that question, but I think it's something I think from the European Parliament and the European Commission, we really need something quite urgently, because it's holding up and costing research an awful lot at the moment. I'm going to just turn to our researchers, perhaps Professor Astras, if you'd like to comment. We've heard a lot of discussion today and a lot of positivity about potential change. Are you feeling more confident or comfortable that we're going in the right direction, or are you still anxious?
I am always optimistic about these things, and I think we're heading to the right direction. The key thing here is to harmonize the data, protect the patients, and enable the trials to run smoothly throughout Europe without any hindering. And I think, step by step, we're going to manage.
Thank you. I'm seeing lots of nods around the panel. It's another specific question about based on the recommendations that were put forward by Professor Vassal. The pseudo-anonymized data are linked by a third-party code, so the code isn't available to the research team. Could this be considered as fully anonymized? And I know that is a hot question, but thoughts?
I mean, go ahead. Sorry, I've been talking too much.
It's okay. Well, personally, I think it can be. The key thing here is not to provide any identifiable data, that it will identify any patient to a certain set of data. If it is anonymized, that covers all bases, and this is the idea behind this, and this is the idea of behind putting a code instead of a name. But as I mentioned earlier during my speech, is the local clinicians will be able to identify their patients through the code, but internationally it will be anonymized.
Thank you, George. And I think this is interpreted differently in different countries. So, Owen, do you want to comment on that?
Yeah, well, in the GDPR definition, it's postulated as identified or identifiable, and the kind of simple act of removing the name and replacing it with another identifier on its own is not enough. I know what you've been doing there is more than just this blatantly obvious thing, but especially since as was mentioned multiple times, these are often very rare cases. It may, even with certain obvious identifiers removed, still be able to identify the person again in some cases. And that is, let's say, where in the GDPR logic, the border lies. But, and this is a big important thing, the fact that something is personal data does not on its own mean that you can't use it. Pseudonymization can indeed be a safeguard, such as those referred to in Article 9.2J GDPR, when it talks about certain safeguards that need to be in place for research. So, for example, one of the safeguards there can be indeed that information that is made available is not made available in a directly identified form, but in an pseudonymized form. And that also then has further consequences later on, for example, the information obligations, how to inform people about that you are processing their personal data. There's an exemption that basically if you as a controller are not able to figure out who this relates to, you can't inform them individually what you're doing, as you would have done if you had collected the information directly from them. And in those cases, you can then, for example, have other safeguards, such as just making that information publicly available of what's happening with the data. So the point is that even if it's not considered anonymized, it doesn't mean you can't use it, and it does come with certain, let's say, things that become a bit easier, for example, on the information side.
Thank you, Aura. That's a really interesting discussion, and thank you to all the people, all the participants in the webinar for all your questions and your engagement in the debate, and to all the panelists for really interesting answers to the questions. I think the summary will be hard to synthesize all this great debate, but with that, I'm going to hand over to, I believe, Carmelo next to wind up the meeting. Carmelo.
Thank you. Thank you very much, Pam. I have to say that this was really an astonishing meeting for several reasons. One of the reasons is the clear definitions of the problems throughout the whole meeting. The number of people attending from the start to the end, I have seen about 180 to 200 people continuously attending the meeting, and let's say the brightness and the good thinking we have heard from all the people attending and from the speakers. I don't want to be repetitive, but I think that the data in pediatric cancer is so important as in many other fields, and the quality, shareability, usability, reusability is so important to improve treatments, to save lives, and to improve end results. I understand, I have also understood this morning from the voices of the people reporting their ideas and their opinions that GDPR is a very important tool to protect citizens in Europe, but sometimes too much protection can be detrimental for, especially in the research and in the medical field. I wanted to get back to the survey presented by, the results of the survey presented by Gilles Vassal. The pediatric oncology community is in some way worried about the impact, and we have heard many interpretations from, and Delphine gave us a very passionate but bright and precise view of someone who has lived with her family, with the complications related to the disease and to the contribution from her side with the data. I think that we have all the commitment to work together, and I think that today is the proof that the whole community, not only researchers, physicians, nurses, parents, patients, but also I feel close to us, the European Commission, the European Parliament. And for this reason, I wish to thank Loucas Fourlas for hosting this meeting, and all the participants because they gave great contributions. I think that now we need concrete actions to get the concrete results, and we need to start now, because we will be judged in some way because of the results. We will, within SIOP Europe, we will work tirelessly with all the other stakeholders to get there. So thank you very much again to the speakers, thank you to the attendees, and I will hand over to Anita as a representative of CCI Europe for her closing remarks, and then to Loucas Fourlas. Thank you everyone again.
Thank you so much. From our side, CCI Europe, we want to sum up in a way like, first of all, thanks to everyone who contributed. I told in the beginning I'm really looking forward to listen to all of you, and I have to say I was really, really impressed by all the MEPs and their support. regarding our concerns when it comes to GDPR and not to research and all our obstacles we have. But I also want to thank Owen and the Commission, because I learned a lot today. Also, I have heard news. They can be very helpful for the future to harmonize the GDPR Europe-wide. I have never heard before about this, the board of the data protection board. Yeah, so I learned something. But nevertheless, as a patient, parent, survivors communities, we have to stress out that we can achieve a lot in the next years, or we want to achieve a lot to support with the great support of the EU. And therefore, we have to solve these pressing problems now and to use the momentum to look at the recommendations, what we have presented today by Gilles Vassal, to accelerate the research, because this is crucial for a better and adequate treatment for children and young people with cancer. What many people said today. Thanks a lot, and yeah, for this great event.
The few final remarks, I think that Loucas Fourlas are absolutely welcome for closing, let's say, this very, very important meeting. Thank you again from all our community people. Thank you, Loucas. You are on mute.
So I will be very brief. It was an honor for me to host this event. I would like to thank everyone for their participation. After today's session, we have a better picture, I think, on how to proceed further in the future. Closing with a phrase that I said earlier, we have to and we will beat cancer. We owe it to our children and our people. Thank you very much